Good morning and welcome to Our Chicago. I'm Samantha Chapman. A new study found that nearly 3/4 of adults in the United States are affected by obesity or overweight. That study, reported in the medical journal The Lancet, found that by 2050, nearly 260 million Americans could be impacted. One of the authors calls this situation an epidemic. This morning, we're talking about what we know about obesity and how we should address it. Our guest is Dr. Silvana Panine, Director of Chicago Weight at UChicago Medicine. This is an interdisciplinary weight loss program and support group. Tell me more about this group, Dr. Silvana.
So first of all, thank you so much for having me. So this group was put together 12 years ago, and as appropriate, we have staff dietitians, psychologists, and medical providers such as myself and nurse practitioners. And I am board certified in endocrinology, but also in obesity medicine, and all the staff has been trained in specifically treating patients suffering for obesity or overweight.
Let's talk about the numbers. How many people are obese currently, and should we be looking at this as a crisis? Is this a major concern in our country?
So according to the most recent statistics, 43% of US adults have obesity, which is a body mass index of 30 or higher, and 73%, close to 75%, as you said, as overweight and obesity. And when it comes to the children, we're looking also, depends on the age, as much as 20% or more. And so yes, it is absolutely health care crisis. And for a few reasons, because this is really impacting the healthcare costs in this country. So in the most recent estimates, we're looking at 100 to 200 billions of healthcare costs associated with obesity and its complications. It also is not really accounting for what we call the indirect costs, meaning the costs associated with absenteeism, with decreased productivity and disability.
Obesity is linked to a number of diseases. Of course, we talk about heart disease and stroke, but is obesity itself a disease?
Absolutely. Obesity meets all criteria to be defined as a disease. Obesity has its own genetics and biology, and has its own complications, as you mentioned, diabetes, hypertension, heart disease, and more, and has its own treatments, anti-obesity medications, and weight loss surgery. In fact, 11 years ago already, the American Medical Association defined obesity as a disease, and all societies have been following since.
Americans sometimes get a bad rap when it comes to the way we eat, how much we eat, or how inactive we are. Do you think there are more factors to that, though, when it comes to obesity? Is there more to this story?
Absolutely. I mean, we do know that diet exercise are very important, but they don't tell the whole picture and the way that we understand it now. So what we know now, that there are many factors, many in the environment, which may affect our propensity of gaining weight over time. For example, the sleep restriction of our modern society is being known to increase the risk of obesity. Also, there's been in the last 20, 30 years an increased prescription of medications that clearly are associated with weight gain. And also we know there are chemicals in the environment, probably in the processed food or the food packaging or other sources, which are really changing the way our body senses energy balance.
That study in The Lancet was based on a person's BMI, also known as a body mass index. Is that a good way to determine if someone is obese?
It's a good measure in population studies like the one you're mentioning, because it correlates well with, for example, health outcomes. But at a personal level, we try to obtain, when possible, other measures of obesity, but also we try to move away from numbers such as pounds or BMI, and we try to focus on health outcomes, for example, the benefits of weight loss.
Dr. Silvana, thank you so much. Don't go anywhere. We will be back with more on our discussion after a short break.
Watch breaking news on YouTube. Subscribe to ABC7 Chicago Eyewitness News.